Great. So then I'm going to give some quick opening welcoming remarks and then hand it over to Colin. Thank you everyone for joining. Really excited to have our first kind of press conference slash Q&A slash report release all wrapped up into one today via Zoom. So of course also thank you to Mayor Alejandra Sotelo-Solis and Rob Schupp for speaking and sharing their perspectives on our report, which is called Essential Transit. So quick Zoom basics before I hand it over. Everyone who is not a panelist is muted, and we're going to keep it that way until we get through our three speakers. Though if you have technical issues or questions you just don't want to wait to ask, feel free to put it in the chat room and we'll definitely be monitoring that. The way we're going to, well, actually, I don't see anyone who has called in from the media. So, if you do have a question, you can use the raise hand function that should be available to you next to your name if you click participants. If you click more, or it's not an option for me, but there should be an option for raising your hand next to your name. Tell me if that's not accurate for the location though, but it's my understanding. And then when it's time, we'll call on people based on who's raised their hand. And like Colin said, we are recording this, so we'll be publishing it later just so everyone is aware. And with that, I will hand it over to Colin to get us started.
Great. Thanks, Maya. And thanks, everyone, for calling in and to participate. So my name is Colin Parent. I'm the Executive Director and General Counsel with Circulate San Diego. We're a nonprofit that operates region-wide in San Diego. We focus our work on public transit, street safety, and sustainable growth. And today we're very pleased to be releasing a report, or a white paper rather, titled Essential Transit. And so what the report identifies is that there is a really large share of essential workers who continue to rely on public transit even during this time of COVID-19. So we collaborated with actually a former intern of ours, Annie Ferrillo, who's on the call with us and can help answer any technical questions that may be beyond me if there are some. And we're really inspired by a similar report published by Transit Center, a national nonprofit that published some national data showing the share of essential workers nationwide who are transit commuters. And so they based their, so we looked at that and said, hey, that makes a lot of sense. Let's do a local version of that. So what we did is we were able to get some of the information that Transit Center had, and then also look at American Community Survey data that's collected by the census that already shows the commute modes of workers of all different categories. And so we were able to look through, identify which of those work categories are considered essential by the governor's orders, and then identify the share of those essential workers who are relying on transit. So we were able to publish that data. And this is really important to highlight that even though fewer people are taking transit, even though the transit agency themselves is encouraging people not to take transit unless they're taking essential trips, the essential trips are absolutely still happening. People are using the trolley and the bus to get to hospitals, to do work at hospitals. They're using the trolley and the buses to arrive at their jobs as grocery clerks, and to service pharmacies. All of these things that are really essential to keeping society happening are happening, and they're happening on transit. And so the report and the data that we're publishing today helps illustrate that, and also helps illustrate why we need continued support from elected officials locally and from Congress to backstop the real serious revenue hits that are happening to public transit. Fewer people are on transit. There's still lots of people who are using transit, but certainly fewer than normal. And that means less fare box revenue, which creates challenges for the transit agency. And we need to make sure that that we're holding harmless that transit agency, not only to make sure that they can continue to operate and carry essential workers to where they're going to go, but also to ensure that the system remains stable and functional to help us facilitate the recovery when when the lockdown has ended and we're trying to rebuild our economy. So this is what the report identifies. You can see the report on our website, circulatesd.org/essential transit. We have both a copy of the report as well as 2 electronic appendices that include data that we compiled and analyzed from the American Community Survey. And so those are easy. So everything that's in the report and been used to generate the report is available on our public site for members of the public, for policymakers, and for the media to access. So thanks again for participating on the call. And I think next we're going to invite Mayor Sotelo-Solis from National City to share. And she's not only the mayor of one of our cities in the region, but also a member of the MTS board, who can share about how how transit is being impactful for her city, for her community, and for essential workers throughout the region. Maya, we need to unmute the mayor. Great.
Are we good to go? Can you hear me?
Yeah.
Well, buenos dias to everyone from National City here. It's a beautiful day to stay inside. But we, again, want to just say thank you to Circulate San Diego for, providing this data, because we know that communities like National City are some of the hardest hit because of COVID-19, and we have been historically underserved when it comes to certain resources, but many of National City residents are those essential workers. I shared yesterday with our media partners, like you said, council member or director today. They definitely are the ones that are using the mass transit to get to work. And we know that a high percentage rely on these transit lines. And according to MTS's own impact report listed last year, National City has the highest transit ridership per capita in the region. So as we talk about those impacts, whether it be closing, or shortening bus routes, or eliminating or delaying, it definitely impacts our community. So those folks are getting on to go to work, but also to get home. And that's why, it's so important to make sure, just like our water, just like our sewer lines, our trash pickup, that mass transit continue to operate. Even with, the impact and the hit that it's taking right now, people are still using it. So as the vice chair of MTS, we know we want to make sure that they're running efficiently, effectively, and those transit lines are those lifelines for our communities. We've also wanted to create policy that makes it safer. And we just approved rear door boarding. So again, taking into account that, our essential workers are the ones operating the buses themselves. And so we're, as well as the riders. So rear door boarding improves that safety for both the riders and the drivers. Again, we want to appreciate Circulate San Diego's efforts in providing this report for our communities. We know that at the end of the day, all of our industries are being hit, and the community and the government agencies that are providing those resources, we're going to have to think creatively on how we address, one, the loss of revenue, the loss of, just what the next step is, and just having people think outside the box, what will be the new normal. And as the vice chair sitting alongside Supervisor Fletcher, and Mayor Mary Salas, we know that there's going to be a lot of ideas that will be at the table, and we have to be willing to say, well, okay, why not? Let's try it with the health and well-being of our constituencies at the forefront, and that being the riders and the employees of the mass transit. So thank you again for the opportunity to be here and to share a little bit from National City and MTS. Muchísimas gracias from our community. And later today, just so you know, we will be having a joint presser on behalf of the South Bay mayors regarding face coverings. So we thank you again for taking the lead on this and again, expressing the importance of mass transit. Thank you.
Great, thank you very much, Mayor. So next we're going to have just some comments from Rob Schupp from the MTS staff. And Rob, love to hear from you about sort of what you guys are seeing on your system, how people are continuing to use the system, even for non-work essential trips. And then please also feel free to talk about some of the things that the mayor referenced about what steps the agency is taking to keep the system safe, both for riders and for transit operators.
Sure. Hey, thanks, Colin. Thanks for having me. Thank you, Mayor. MTS is really fortunate to have great leadership. Both Nathan Fletcher and Mayor have been outstanding in giving staff direction and making sure that our essential services continue out there. I thought I'd start with a little good news, because your report did include some of our employees that had tested positive for COVID-19. 2 of our workers have fully recovered and are back at work, so that's really good news. So we have still a couple of bus operators that are at home and recovering, and a couple of our facilities people too. You know, the report also pointed out how well we were doing in ridership, and this is taking a tremendous hit on our riders, our ridership numbers and our revenue numbers. We were off about 30% in March, both on bus and trolley. And even so, our fiscal year begins on July 1st, 2019, and so through February, we were up a couple of million riders. Even with the huge decline in March, we're still about even from last year. So, you know, we were doing really well. It's we had made all of the right moves to get ridership back, this is devastating for us all. We expect, you know, our revenue numbers to be off about 20 million this year, another 45 million next year. So ridership's going to continue to decline. But still, you know, we are providing an essential service. We still have about 75,000 riders a day, and clearly those people are getting to work and they're making essential trips to you know, people have to, not necessarily working at hospitals, but they need to get to the hospital. They need to get to the doctor, to the grocery store. So we're providing all of that service. Our priorities really have been to keep our riders and our operators and our employees safe. We've done the rear door boarding. We're not accepting cash. We still want people to pay a fare, because free rides induce ridership, and maintaining social distancing is really important. You know, we kept full service going well until the beginning of April, and that has allowed our passengers to maintain social distancing. We reduced some service, but we've got enough service out there, I think, now, so that people can ride and feel safe. Where there is a little bit of overcrowding, we're monitoring that carefully, and we'll throw more buses out there if we need to. When we looked at our ridership to see if there's some direct correlations between the Circulate study, there definitely are. It's sometimes hard to make that direct correlation, because so many of our routes serve multiple destinations. So while they're serving hospitals in Chula Vista, they're also serving Southwestern College. And so, you know, the ridership is way down on those routes, but primarily due because everybody's taking classes remotely. The best example is up in Hillcrest, where we've got the Scripps Mercy Hospital and we've got the UCSD Medical Center. Ridership on those routes is down less than the system average. So that kind of indicates that, you know, we are providing that essential service to those essential workers there. Overall, we've got about 25 routes that provide direct service to medical centers and hospitals. Those routes are generating up to 30,000 trips a day, so that's about 40% of our ridership. So again, there's that direct correlation between our services providing it to medical centers and providing essential rides to those workers. But clearly, as you pointed out, Colin, there's a lot of people that depend on transit. They do not have an alternative, and they still need to go to essential trips. They're not maybe essential workers, but they have essential trips to make, and it's vitally important that transit remains robust and provides that service to those riders.
Great. Thanks very much, Rob. So now we, that's the end of the formal part of the panel, and we're happy to take questions from members of the press or from the public about the report or from our panelists. And so, as Maya said, you can go to the participants section on your Zoom, and then there's an option to raise your hand, and then that'll put a little logo up next to your name. And then Maya can call on you and unmute you and let you ask a question. Looks like Dave is raising his hand in a more analog way.
Oh, okay. Unmute. Okay, Dave, you are unmuted.
Okay, can you hear me?
Yep.
Yes.
All right. I have heard that in other cities, mass transit has actually been stopped. Is there any chance of that happening? And what would be the conditions that would necessitate or that would lead to something like that happening?
You want to unmute the mayor?
Hello. Yes, can you hear me?
Yeah.
Okay, so I'm over here shaking my finger saying no. Thanks, Dave, for the question, but we at MTS have seen it truly, and I'll let Robert also to respond, but we've seen it as a necessity, as one of those things as I compared to water, distribution, trash pickup, the essential true vein to getting people to where they need to go. So at this point, we have not had conversations at all. We've talked about, changing the frequency in those, bus lines, but we have, I don't think, had those conversations because that's truly, like I said, the lifeline for many people. Robert, I don't know, Maya, you wanted to.
Yeah, hey Dave, how you been? This is Rob at MTS. It's good to see you. We talked on the phone, but I haven't seen you in a long time. I think the region has done such a good job of getting ahead of this. The stay-at-home directive by the county happened fairly early in the process, and I think we've done, knock on wood, that we've kind of reduced that curve, and we're doing really well. I think transit was declared essential very early by Supervisor Fletcher. I think it will continue to be unless a lot more people start to get sick and more drastic measures have to be taken. But I agree with the mayor that there have not been any conversations about eliminating our service, and I don't think there would be unless the situation got a whole lot worse.
Dave, let me just share too that I think your question kind of brings to it's sort of informed by, I think, part of the very reason why we're putting this report out, right? Is that there's some who are saying, oh well, let's not, let's close everything down, like let's not have people near one another, like that like transit isn't, most people don't ride transit, and it's not, they may think, well, then obviously we should close down the transit. And the point of this report is to make sure to clearly communicate to people that know that actually transit it's still running, it's still providing an essential service for things that are being that are sort of universally regarded as essential. And so we want to help this report get out there to preempt folks from kind of drawing these unfortunate conclusions. And keep in mind too that we live in a region where you have some people, including some people in elected office, thinking we should get rid of transit even before COVID-19, right? And that just didn't make sense then, and boy, oh boy, this shows that it certainly doesn't make sense now.
You're not accepting money, so just cards? And will this be the new normal moving forward? Is that, do you think some of these changes are going to be permanent? Roping off the front of the bus and bus drivers having masks and gloves?
Do you want me to take that, Mayor?
Robert, I'd go ahead and let you do that, but because we're just talking about what the new normal is, and so go ahead.
Yeah, I mean, Dave, that's one of the biggest challenges that we all have is how do we come out of it? How do we come out of this? What are the phases that we take? And this is my personal opinion. It's not based on any kind of direct communications I've had with the county, but I think, social distancing is kind of going to remain with us for a while. I think face coverings are going to remain with us for a while. And I think it's going to take a while for our ridership to come back. And, my job as the marketing director is to get more riders. And I think it's going to be quite a while before I'm more aggressive in the marketplace and encouraging ridership. Right now, we're doing all we can to make sure that only essential trips are taken. We've got signage up all over the place, encouraging face coverings from our passengers. All of our drivers are required to wear face coverings now. They get masks, they get sanitizers, they get gloves. So I think a lot of that is going to be with us for a while, but for how long, it's really impossible to predict right now.
How do you get those people back? How are you going to draw them back?
Well, again, I think what we're trying to do right now is to emphasize all that we're doing to keep the system safe. I think that's going to be primarily on people's minds when we all are ready to go back to work. People are going to think twice about riding transit and being in close proximity to others. I think what would really help is a vaccine or a treatment that worked. That would be good. If I could invent one of those, I'd have no qualms in encouraging ridership. But time will tell, Dave. It's gonna, how we get out of this is the big question for all of us, I think.
If I might add, just related to that too, I think one thing that that MTS has been able to demonstrate, just as other transit agencies have, is that people will choose to ride transit if it's affordable and if it's fast. And the agency over the last year or two has really made have been making a lot of changes to try to make to improve service, to improve frequency, especially on attractive lines. Obviously, that now there's a very big different factor at play, and it's going to change consumer choices. But I think that as the disease recedes or its danger recedes, my sense is that transit agencies, both locally and nationally, are going to be able to rebuild their ridership just in the same way that they were being able to build their ridership before, by being an attractive service that makes sense for more people.
I mean, as an example, that's absolutely right, Colin. Leading up to this, MTS had taken more money and invested it back into service. We increased our frequency on the Blue Line, and Blue Line ridership in February was the best ridership we'd had on the line since 2006. So, adding frequency, making it more convenient, that's always going to be part of our equation, because those are the keys to ridership.
Anyone else would like to ask a question? You can raise your hand. I guess we will also accept non-digital analog raising hands if anyone prefers that way. Want to have Andy, one of our report authors?
Yes. So hi everyone. I'm Andy Farilla. So as was mentioned earlier, I interned at Circulate a few years ago and helped out with this report. And one thing that I noticed when I was doing the research for this, and then I included it in the report, was that on MTS's website, Rob, I know that you mentioned some of the cleaning enhancements that you made in response to the hepatitis A outbreak in 2017. And it's something that I know, I mean, I live in Washington, D.C. now, and I know one challenge there's been here is that, like, with all the cleaning enhancements they've had to do in response to this crisis, they've had to, like, in some ways that's necessitated, like, some service reductions, like closing metro stations and stuff like that. So if you could talk up some of it, I'd like to hear a bit more about, like, what some of those enhancements are and how you think those might have given you a leg up in terms of being able to maintain some of this essential connectivity.
Yeah. So when Hep A hit, we did up all of our cleaning regimens and moved to CDC approved cleaning materials. I want to emphasize that we clean all of our vehicles every night, so all of the surfaces get rubbed down with approved chemicals, so they're disinfected every night. But when this hit, we also worked with the county to put hand washing stations at all of our trolley stations. We have now crews that have been redeployed to our major transit centers that clean vehicles as they come through. When buses come in, and not all of our buses come in midday, but those that do get disinfected during midday. So we've got crews out at our trolley stations wiping down everything. Those stations are cleaned every day, but we have periodic cleanings during the day now. So again, convincing people that our system is safe and clean is our top priority.
Great, thank you.
Thank you.
Any other questions? No one should be shy.
Oh, the ballot measure you were working on that just got scuttled that Mr. Fletcher said, well, obviously this is not the year for it. Talk a little bit about that. And is that going to be back, do you think? Obviously there was the need that was being proposed, it still exists.
And
Well,
just before you get started, I'm sorry.
Nope.
Just before you get started, we do have a question from one reporter who has their hands up also, and we have a question in the chat room. So just being aware of everyone's time, we do have at least 2 more questions lined up.
Great.
Okay.
Okay.
Yeah, that was another disappointing. Mayor, did you want to comment on that at all before I launch?
Maya, you want to unmute the mayor? She's still.
Hello?
Yeah,
Okay.
I can hear you now.
Okay, I was just gonna say, it was part of the discussion at the last board meeting, and, you know, everybody's talking about still, you know, food and belly, roof overhead, and when we're talking about a tax or ballot measure, it really is something that we'd be tone deaf if we did not think about holding off. And not reading the room, because in fact, although we do have the ridership, everybody is being hit financially. And so we decided to put a pause, but we know that the statistics and the ridership in the past has shown that, and even the support for overall improved mass transit opportunities was there. So if we shook that 8 ball, all signs looked good. You know, everything was really positive. But we have to recognize that at this point in time, not the best. And so that's why we hit pause. I don't think it's a no forever. I think it's a just no, not right now. Robert.
No,
I
think
the one who asked the question. Dave. Thanks,
Yeah.
Dave.
Yeah.
Or Robert, was there anything else you wanted to add?
Well, I think that really hits it all. I mean, again, another huge disappointment. I think we worked really hard with the community to develop a plan that was community-based. We really answered the needs of the various communities within our service territory. It was going to do exactly what Colin was talking about earlier. We were going to have frequencies, increased throughout the system. We were you know, it was a good plan that met the travel needs of the entire community. So it's disappointing that we were that close to, you know, all of our polling showed we were within the margin of error to get that 2/3. So we were really confident that we had a great plan moving forward. But as the mayor points out, I mean, it's not the right time, and we've got to focus on our system. We've got to focus on keeping people safe. So that's what our staff is devoted to now.
So I wanted to call on Claudia, so I'm unmuting her. You're unmuted.
Good morning. This is Claudia Bucio with Univision San Diego, and I was hoping that we could get a response in Spanish. I was thinking maybe Mayor Sotelo. I know we spoke yesterday, but basically if you can tell us how important, I know this has been answered during the conference, but in Spanish, just how helpful is still public transportation for our essential workers, and also what might the new normal look like, and what are some of the things that, you know, essential workers who use this transit should be aware of?
Bueno, gracias Claudia por la pregunta. Es que vemos que la mayoría de la gente que todavía usa el tránsito público viene de nuestras comunidades aquí en el South Bay por la línea azul. Y también sabemos que más de 33% de la gente o del personal esencial, los trabajadores, todavía están usando tránsito. So para nosotros, yo de ser la alcalde, pero también la vicepresidente de MTS, es importante que estos sistemas siguen trabajando, siguen dando este servicio a nuestras comunidades y también tener esos precauciones de salud. Pusimos desde el principio más estaciones para poder lavar las manos para la gente que vaya a abordar o que vaya a salir. Segundo, pusimos secciones para proteger a los manejadores de los camiones. Y también empezamos una regla en donde la gente puede subir al camión por lo de atrás, la puerta de atrás, para que no tengan que pasar entre esos 6 pies enfrente del camión. So, es algo que es prioridad de MTS, la salud y la protección de no nomás los trabajadores y los conductores, pero también la gente de nuestra comunidad. Y vamos a seguir haciendo lo más que podemos, y pues por eso es tan importante que Circulate San Diego hizo este tipo de reporte, porque mucha gente piensa, oh, pues ya no hay tránsito, y eso no es la verdad. Estamos aquí trabajando, los servicios aquí están, a lo mejor están dilatados un poquito porque ya no están a los 7.5 minutos que habíamos pasado el mes pasado, pero todavía están a los 15 minutos, que todavía es buen tiempo. So, para nosotros, todavía el tránsito está a su servicio aquí de parte del MTS, y vamos a seguir manteniendo reglas y para la salud de nuestra gente. Gracias.
Gracias.
Thank you, Mayor. And we do have one question, well, kind of 2 questions in the chat room, and hopefully everyone just has a couple more minutes, and then I think we'll probably wrap up. So from Melanie Curry, she says, have you had trouble getting PPE for drivers, and have you considered providing PPE for riders as well?
I guess I'll take that one. We have had difficulty in getting masks for our drivers. That was a struggle for a couple of weeks, but we've seemed to have enough supply now to last us quite a while. A lot of the shipments that we ordered for face masks were diverted to essential healthcare workers. So a lot of our orders got redeployed in more important areas. So we are requiring all of our operators to wear masks now. We will look at in the future to provide some of that. Certainly, we've got lots of hand sanitizer on order. We're going to be handing those out to our riders in the future. But we strongly encourage all of our riders to wear some kind of face covering. It doesn't have to be an official mask. It can be a bandana. It can be anything that really, you know, covers your face and your nose and your mouth. So we want everybody to do that. We aren't requiring it now, and our main focus is keeping our drivers fully equipped with PPEs.
Oh, one other thing I wanted to add that to what Robert mentioned, we are also too, for Claudia that's on the line as well, we have been making announcements, those PSAs of face coverings, a reminder of the 6-foot distancing, the, you know, sanitizing your hand in multiple languages on both the bus and the trolley line. So it's not just the visual, it's the auditory, it's the actual stations. So it's all those things that, and that was brought about by our board members. I'm very proud to say that, you know, when we recognize the diversity, and even when we were working on the ballot measure, that was one of the impetus that the community kept stressing. It needs to be multilingual, it needs to be diverse, it needs to be in multiple ways, because there's people that, you know, again, different abilities. So we have that as part of our PSAs as well.
Mm-hmm.
So I don't see any other questions. Colin, if you want to wrap that up.
Yeah, thanks, Maya. And just want to thank everyone for participating on this with us, especially Mayor Sotelo-Solis and Rob Schupp from MTS for participating on our panel. Thanks especially to Andy Ferrillo for helping put this thing together. We really benefited from your expertise and your time and commitment to this. So just want to also encourage everyone, if you support the work that we do at Circulate San Diego, think about becoming a member, circulatesd.org. We love to have your support as we continue to be able to do this kind of work during these challenging circumstances. So with that, as Maya said too, we're going to post this video online if people want to see it. You can download the report and the appendices at circulatesd.org/essential transit. So with that, thank you very much, everyone. Wash your hands and be safe.
Thank you.
Thank you.
Thanks.
Thanks, everyone.